Welcome back to Transform Kenya in partnership with the Bill and Melinda Gates Foundation. In case you're joining us now, our panelists are Cleopatra Mugenyi, Frida Githuku, and Pinky Gelani. We're looking at the pandemic stall on women with a highlight on economy, health, and leadership. You're welcome to participate and let us know what your thoughts are and chip in, agree, disagree, whichever. Do let us know. Muita Patrick says that I totally agree with the panelists that COVID-19 has taken a toll on women with a loss of income. Mental health is on the rise. And let me go back to the panelists. Now, I'll start with you this time, Frida, on the question of leadership. One of the reasons why we possibly have a big challenge and these things happening is maybe we may not have women at the decision table, as many women as we should. Is that a fact? Do you think that we have enough women on the decision table? And if not, why? Frida, I think she may have frozen. We might have a challenge there with network. Let me throw the same question to you, Pinky. Do you think we have enough women on the decision table? And if not, why?
So, thanks, Mike. I think that the representation maybe in the last decade has definitely increased, but the obstacles have not. And now what you need to do is throw in a pandemic, right? Men and women, I feel, make equally good leaders. And there's little consensus on why women remain unrepresented. Of course, there are stories of family obligation, inexperience, women not being tough enough, women being too tough. But every woman that I've spoken to say that it's up to us to pull a seat at the table. So, you know, just really be a part of this. Women are very well educated and just as hardworking as their male counterparts. But it's often said that women meet more resistance, and maybe this is the reason. They meet more isolation as they go up in the rank. There was an article that I read in Forbes magazine which stated that women have to deal with different stresses than men, especially, you know, when they are in different environments. Women start out with the equal determination and the equal, you know, sort of eagerness to become a leader. However, the everyday pressure and them trying to fit in leads them to sort of second guess themselves, and caution leads to inhibition. So maybe this is a reason that we're not seeing enough women leadership. And maybe we as women probably are not being courageous enough to, you know, we often second guess ourselves. Women systematically underestimate their abilities, and I feel that.
All right, and we certainly have, you know, made progress. We're not where we were 15 years ago, but there's a lot that needs to be done. Cleopatra, what are your thoughts as to why we do not have enough women on the decision table, if you agree that indeed we do not?
This is an interesting question, and Pinky has touched a lot on what the thoughts are around social norms and as well as how women may be raised to think of themselves. But for me, I'd also like us to sort of situate this again within the coronavirus pandemic, and think about the roles that women have played in the response to COVID-19. There has been a lot of good female leadership around the world when it comes to COVID-19. When you look at the countries that are led by women, New Zealand, Germany, Iceland, Finland, Norway, Taiwan, they have some of the best responses to the COVID-19 pandemic. So female leadership works. When you then look at frontline health workers, the ones who have been in the hospitals, taking care of our ill, taking care of people at home, they are women. So women in leadership do exist, maybe not at the highest levels of leadership, but they're women leaders at all levels of society. What can we do to change that? What do we want to see more women at the highest levels of society? We need to give girls from an early age the same opportunities that we give boys. We should, from the household, the family, in school, we should not be telling them that they have a role to play because they're a woman. And usually the roles we tell them they have to play are subservient roles, are nurturing roles, are roles that are close to home. We need to be telling our girls and our young women that they can fly as high as they need to. Then we also need to raise our sons and our boys to understand that women and girls can be their equals. Because also why, when we have female leaders vying for elected office, why do we not vote for them? And yet they will actually have the same and maybe even better credentials. So I think it's opportunity, it's encouragement, and we also need to change our social norms about what a good leader is.
All right.
Back to you, Mike.
Okay, Frida, I think we have you back, and there's evidence, and I think Cleopatra has alluded to that, where there is female leadership on the response for COVID-19. We certainly can see very positive reports. What can we do to ensure that we have more of that, even at the grassroots level? Because I know when it comes to, say, for instance, leadership within parliament or government, there are certain laws and structures that are supposed to be abided by. But when it comes to the family setup, when it comes to the rural setup, there may not be that formal rules and guidelines as to how we can have more women. So what do you feel would be a way to have that done?
First of all, the number of women in leadership is accounted for. The way we define leadership is very limited. Like you rightly mentioned, we tend to look at parliament, assemblies, judiciary, and all that. There are so many women leaders at the community level. There are so many women leaders sitting in the land control board, making decisions on how land is transacted in health committees. That is something that we also need to account for. And the numbers are increasing because we have put in place good laws. Of course, there's still the barrier, like what we spoke about, gender-based violence, that keeps women very far away from the public space, of course, because they want to protect themselves. But culturally, we need to model differently who is an ideal leader. My colleague was laughing today when I told her that the global image of an ideal leader is a white male macho man. If you do not come closer to that, then the far you are from leadership. And it may sound harsh, but this is really true. And when we produce this kind of symbols, then girls cannot visualize themselves as leaders because they see themselves very far from what is, of course, symbolically meant to be an ideal leader. But also boys fail to understand then what quality of leadership girls and women will offer. Because that is the symbol that we are putting out there in the world. Of course, when you come to a continent, then that would be a black male, and it's not any better. At the family level, sadly, we've come, but this is now changing, and we've seen, of course, a lot of support from men as fathers, as siblings, as husbands. But initially, we would model girls to be wives, to be mothers, to be good daughters, and not to be leaders. Those things are not mutually exclusive. One can be a good mother, a good spouse, and a good leader. That dichotomy in our socialization does not need to exist. I think we are putting effort, even through popular media, to fight that notion. And if we stay on that course, then we will get it even at the grassroots level.
All right, we have a few minutes now to go before we wind up, and I need a call to action from each of you. We've talked about the economy, the challenges that are there, health and leadership. I'll start with you, Cleopatra. What is your call to action to address the pandemic's toll on women, or what is the most important action that you think needs to be taken to ensure that we address this toll on women?
Thank you, Mike. I think that we need to include women at the decision-making table, and we also need to include more women in the pandemic response when policy decisions are being made. Women and girls and other vulnerable members of society need to receive more attention than we have been giving them, and we need to come up with specific strategies that will not only protect women, but will also help women come out of the COVID-19 pandemic stronger. the unfortunate reality is that many of us are not going to be coming out of this pandemic stronger, and women are going to be left even further behind. So we need to boost women's livelihoods, and we also need to create an enabling environment to help these women not only survive but thrive as we come out of this difficult period. Back to you, Mike.
Okay, and Frida, your closing remarks and call to action. What must we do first?
I think it is important for us to strengthen our social protection program in response to be able to deal with this kind of crisis, because they'll come in the future. And here I'm looking at putting an infrastructure, even in terms of data system of who are our vulnerable household, where do they live, what is the economic profile, and what kind of support would sort them out. I saw the struggle that was there in the counties when the relief was being offered, and actually the women had to go out and do an enumeration process soon after we had completed our census. I still do not understand why we had to do that, yet we had completed our census. There's something around our data, and especially on vulnerable people, that we need to work on. Then the policies that we develop have to be fit for purpose. I will keep giving these examples because we are living these lived experiences. I did interact with one of the counties that as part of the economic stimulus package, I think they had an MOU with a commercial bank institution in the country to offer loans to SMEs impacted by COVID. And what surprised me or disappointed me with that arrangement is that this fund is supposed to serve as a guarantee fund, but it's directed toward trade organization and towards a cooperative. We know that women are not in cooperative, and there are less of them in trading organization. They exist in groups. So that kind of an intervention is not fit for purpose, and it is not gender responsive. So even as the state goes ahead to design intervention model, they really need to do a gender screening of the intervention that they are making, and even an age screening, because some of them may not be fit for the youth as well.
I'm going to have to cut you short because we need to manage time here. We're just about out of time, and I need to get Pinky to give us her closing remarks and call to action. Pinky, in brief, what must we do?
Okay, so I will make it quick. Thanks, Mike. The response, I think, should focus on what women want. I think I will say it in fourfold. One, it needs to save lives, as we've spoken about. So yes, of course, follow the rules, but ensure that women can access services. What we've spoken about, Cleo and Frida both mentioned it, maternal health and gender-based violence. So that's number one. Number two is women, of course, need to be taught how to be more resilient. We are resilient in nature, but then this is where mental health comes in. So mentally, emotionally, and of course, psychosocial services, I'd really like to see that sort of come up in front as well. The social protection system, the financial systems as well, our framework needs to be worked on. And to the women who are watching, I encourage you to bounce back. Here, I'm going to leave you with this quote: never waste a crisis. You can either cry or you can be the one selling tissue. That is completely up to you. Let's not discard women's ability to participate in the economy, which is essential for productivity and growth.
Thank you very much. That is Pinky Gelani and Frida Githuku, Cleopatra Mugenyi, who were with me this evening discussing the pandemic stall on women. And I think that's a beautiful quote to finish with. And well, you can either be crying or the one selling tissue. That is really just talking about opportunity and ensuring that, in Pinky's words, you bounce back. That right there marks the end of Transform Kenya Tonight in partnership with the Bill and Melinda Gates Foundation. My name is Michael Gitonga. Thank you for watching. Do stay with us right here on KTN News. We've got news coming up at the top of the hour. Do take care of yourselves. Keep safe. Take care of yourselves and each other. God bless.
Transform Kenya.